This segment of Delmarva Life is brought to you by Community Behavioral Health.
Imagine washing your hands 5 times before you're finally satisfied they're clean. Or you check the front door just to make sure it's locked over and over and over and over again before you finally go to bed. These are common signs of obsessive compulsive disorder, or OCD.
But the anxiety disorder can be far more complicated. To give us some more insight on OCD is Dr. Suni Jani of Community Behavioral Health. Thank you, Dr. Jani, for being here.
Thank you for having me.
I think everybody has heard of OCD, but tell us what it is. What is obsessive compulsive disorder?
So it's a psychiatric condition, and it has 2 parts to it. So you have to have obsessions, which are known as recurrent unwanted thoughts, and then they have to be followed up with a compulsion, which is a behavior, and it's not necessarily a physical action. It could also be sometimes another thought. There are many different ways that they happen, but the point of this action is to make your obsession go away, and it's not necessarily related to your obsession, and it's usually excessive. And the main thing with a mental illness is that it is functionally impairing. So it gets in the way of your life, and it causes you suffering, and it prevents you from doing the things you want or need to do.
There's a whole bunch more levels to that than I really thought. Is OCD very common?
You know, it's much more common than we realize as well. So in the United States, at least 1 in 40 adults have it, and about 1 in 100 children.
Wow.
Yeah.
But like you said, there's probably varying levels of it.
There are. So, you know, like with all mental illnesses, it's on a spectrum. And in DSM-5, so the new version of the Manual of Psychiatric Illnesses, there are several versions of it. So we have something called body dysmorphic disorder, which is where people are obsessed with perceived flaws in their body. Even hoarding, which, you know, there's a popular TV show about that, is considered a type of obsessive compulsive disorder. It's a related disorder to it. And there's even a hair pulling disorder called trichotillomania, where people have a compulsion to keep pulling out bits of their hair. And there's even a skin picking version. So there are many types of this.
We were talking during the break about perfectionism. Is that different than OCD?
It is, but it's also related to it. So in psychology, they've studied perfectionism as a trait of personality. And so we all have traits, and they're good. They sometimes really help us out. Perfectionism is probably why the studio runs so well, and why things come together, and why these shows happen, and why people can be great students, why they can be hard workers, why they can multitask, why people make sure they deliver a fantastic finished product. And then when you kind of turn it up to a 20 rather than a 10, sometimes perfectionism prevents you from getting things done on time. And sometimes people go to therapy just for that trait. And sometimes that trait puts you at risk not only for OCD, but for some other mental illnesses as well.
Very interesting. Okay, so is this something that you're born with, or does it develop as you age? How does that work?
Like a lot of mental illnesses, it's sort of like, you know, there's a biological risk for it. So if one of your family members has it, you have an increased risk of having it. There is also a very interesting connection with streptococcus, actually. So some children who may have had a streptococcus infection are sometimes found to develop OCD later on in life. So some of the treatment for OCD, believe it or not, is related to the treatment of streptococcus. So there's a lot of different origins to this.
So you're talking strep throat?
Strep throat, yeah.
Wow.
Yeah.
And like you said, there are treatments for OCD.
There are. So, of course, the most common treatment is cognitive behavioral therapy, which is a extensively studied, well-known type of therapy for a lot of different mental illnesses, but this one's specifically targeted towards OCD. And there's a part of cognitive behavioral therapy called exposure and response prevention. So you're exposed to the thing that causes your obsession and compulsion to be triggered, and then you're prevented from acting on it. And practicing this keeps it at bay. Again, there's the strep throat treatment, believe it or not. Along with this, medication. Sometimes people get better on medication alone, but again, like with all mental illnesses, a combination of medication, specifically antidepressants, along with the type of therapy, has been found to create a very good remission and excellent quality of life. Recently, actually, transcranial magnetic stimulation has gotten an FDA approval for OCD in adults, but the studies, we're still waiting on them, but it'll be interesting to see if that...
Which you do at Community Behavioral
We do
Health.
that, yes.
Yeah. All right,
That's
Dr.
right.
Suni Johnny of Community Behavioral Health, thank you
Thank
so
you.
much. Very interesting. Could talk about that for a long time.